Hi, Dr. Humphreys. We had a fascinating lecture at South Seas A and B in the Convention Center. Dr. Eric Ebel, a veterinarian with the United States Department of Agriculture, told an eager crowd about bovine tuberculosis. The room was filled with doctors and technicians wanting to learn the latest about this important topic. Earlier, I spoke with Dr. Ebel.
The private cow-calf veterinarian can do a lot to help their client prevent TB by beginning to assess their risks. Well, a lot of people start to think that the problem must be getting worse for TB because we're finding more adult cases at slaughter that lead back to affected herds. But in fact, we think more likely the explanation is that our surveillance is getting better for bovine TB at slaughter.
I also spoke with several attendees at this meeting, and here's what they told me.
The topics that were covered today were some insight on why the states have set regulations for to monitor the surveillance of accredited veterinarians.
I learned the importance of preventing the mingling of wildlife with livestock populations for the prevention of disease outbreaks.
The tuberculosis issue is something that has come to light recently with the number of herds that are being found up in Minnesota, along with the wildlife, the deer, which is a significant finding because it definitely makes it a lot more difficult to control.
I think one of the most important things that we learned from Dr. Ebel's talk was the number of accredited veterinarians that are doing tuberculosis testing. We're probably not detecting the number of false positives on the caudal fold tests, nor are we reporting them to the regulatory agencies.
This material was certainly well received, so for bovine practitioners, here are my 5 clinical gems. Pay attention, bovine tuberculosis could be anywhere. Commingling with Mexico-origin cattle can lead to disease. Wildlife can be a source of infection for our livestock. Do CFT testing with care. State and federal officials are watching this. And lastly, slaughter surveillance is crucial to early detection. I thought this speaker did an outstanding job. The information was very practical and will be a great resource when dealing with this deadly disease. Tomorrow, I'll be at the Four Seasons Ballroom 4. There, we'll talk to Dr. Dave Gerber and Dr. David King regarding the most frequently asked questions when buying and selling a practice. So for Conference TV Journal, I'm VNN reporter Dr. Tony Kremer. See you then.
Thanks, Tony.
Hi, Dr. Humphreys. We're at the Four Seasons Ballroom 4, getting the scoop on an interesting practice management lecture. Dr. Gerber and Dr. King are regional representatives of Simmons & Associates, a nationwide brokerage specializing in the sale and acquisition of veterinary practices. Today they revealed the most frequently asked questions regarding buying and selling a practice. Earlier, I spoke with the doctors.
Well, several years ahead of time, they certainly should get an appraisal so they know what they've got, so they know where they are, so they know where they need to go, so they can do the proper planning, because it can make a big difference in the value down the road. As they get closer in, they need to be thinking about hiring an attorney at the time, an accountant at the time, probably a broker to help at the time. And these are most important, people that are knowledgeable in the veterinary field and have experience.
The key is experience. You want somebody that has experience in the field, that has been there, done that, and can avoid the train wrecks and avoid the pitfalls of selling a practice. Our website is SimmonsInc.com, MIMMONSINC.com, and in that area you can find a regional Simmons & Associate person that can help you in your particular area, because what works for Texas in my area may not work for Idaho and Dave's.
I also spoke with several attendees at this meeting, and here are their thoughts on the subject.
I had 3 goals from this meeting. Number 1 is to figure out an exit strategy. Number 2 is to facilitate that exit strategy where it makes it feasible for an associate to buy in. And the third one is to where I can have an exit strategy where I can still be involved, but to the degree that I want to be involved.
I thought it was pretty interesting for both perspectives, in fact of listening to how people should prepare their selling for their practice and the buyer's perspective as well. Gives them a lot of different opportunities to figure out how it would be best to finance a practice, which is probably the biggest purchase they'll ever make in their life, and being able to possibly do it with no down payment at all is definitely helpful.
That was some great positive feedback. So for this lecture, here are my 5 clinical gems. Veterinarians choose ownership to achieve autonomy and increase net worth. Veterinarians get bank loans due to the fact that they typically have good character, credit, and cash flow. When selling a practice to an associate, explore the real dollar cost of this exit strategy. Non-compete agreements are very important. However, their enforceability can vary from state to state. Selling real estate with the practice can allow you to explore other, more diverse real estate investments. Dr. Gerber and Dr. King did a great job at giving guidelines for those looking at practice ownership. Tomorrow, Dr. Rob Ballinger and I will be reporting off-site from Topaz Center A. We'll talk to Dr. David Biller regarding his small animal ultrasound laboratory.
Thanks, Tony. WVC has a long tradition of educational excellence in all areas of veterinary medicine. High-tech veterinary diagnostics are prevalent in many new veterinary practices. The challenge is to improve our cutting-edge technology to maximize our diagnostic potential. So we sent Drs. Tony Kremer and Rob Ballinger out to the GI ultrasound lab, and they bring us this high-tech story. Tony?
Hi, Dr. Humphreys. I'm here with Dr. Rob Ballinger, off-site at Topaz Center A for the Small Animal Intermediate Ultrasound Lab. This laboratory is being presented by Dr. Biller from Kansas State University. The lab is packed with people getting hands-on experience with small animal ultrasound. Earlier, I spoke with Dr. Biller.
The advantages that I've recognized best when using ultrasound in evaluation of the abdomen are the ability to look inside into the organs of the abdomen. Portability. The machines, most of them are small. They're easily moved around the practice. Probably one of the biggest ones a lot of people will see is the ability to do biopsies and fine needle aspirates under ultrasound guidance so we can see the needle. Probably the most common mistake I see is a person calling something normal abnormal, or a person calling something abnormal normal. The best way to get around these mistakes is read, practice, attend great quality Cs like we're running here at the Western Veterinary Conference. The other one is using ultrasound to give definitive diagnosis. Most of the time, the changes are not pathognomonic for a single disease, so people tend to need to do fine needle aspirates and biopsies. If you're doing ultrasound, you've got to follow it, usually with a fine needle aspirate for cytology or a biopsy for a true cut tissue sample.
Dr. Rob Ballinger was able to check in with some of the attendees.
Thanks, Dr. Kremer. I was able to talk to a few of the doctors attending this lab, and here's what they had to say.
It's a nice clinical approach to use of an ultrasound for people who are not really extremely well skilled but have the basics. It really gives you a good opportunity to learn the anatomy better and to go ahead and learn better ways to image the organ systems inside the abdomen.
It's very well organized, the equipment's excellent, and it's well instructed as well. There's experts that are giving the instruction, which is brilliant.
Well, it's nice to buy the toys, but sometimes you have to learn how to drive the toys before they're any use to you.
I think the most important part is the individual attention that we're all getting. And there's a radiologist for 2 to 3 students, and I think that's great because then we can ask personal questions and get personal attention.
As you can see, everybody that attended enjoyed this lab. Back to you, Tony.
Impressive interviews, Rob. To summarize this topic, here are my 5 clinical gems. When preparing for GI ultrasound, fasting is ideal, but not always possible. Typically, the patient is scanned in either dorsal or lateral recumbency. While gas may preclude complete examination, many abnormalities can still be visualized. Moving the patient from side to side or standing them may result in better visualization. A thorough knowledge of the normal and abnormal appearance of the GI tract is critical. Ultrasound is one of the fastest growing diagnostic modalities in private practice today. This lab kept everyone busy as these veterinarians practice their newly acquired skills. Tomorrow, I'll be covering ophthalmology, exam tips and techniques presented by Dr. Ellison Bentley. So for Conference TV Journal, I'm VNN reporter Dr. Tony Kremer.
And I'm Dr. Rob Ballinger. Back to you, Jim.
Well, Tony, I can see how improvements in ultrasound technique will benefit our patients greatly. Thanks for that story. Let's check in with VNN reporter Dr. Tony Kremer, who files this report on exam tips and techniques for specialized eye care. Tony.
Hi, Dr. Humphreys. Our colleagues enjoyed an enthralling lecture here in the conference center. All eyes were on Dr. Ellison Bentley, an ophthalmologist from the University of Wisconsin, as she discussed ophthalmology, exam tips, and techniques. Earlier, I spoke with Dr. Bentley.
Eyes are pretty scary. They go bad very, very quickly, and it doesn't take a lot to cause blindness and or extreme pain. And most veterinarians are educated enough to know that, so if they're unsure, the safe bet is to refer. The most important thing is to pick your equipment and use it consistently. You can use a very cheap otoscope head that every veterinary clinic has, and you can get a very good exam. You can see the cornea, the lid, the conjunctiva, and the lens extremely well if you use them consistently and get used to them.
Next, we have some comments from doctors who attended the lecture.
Retinal disease has always been a confusing issue, I think, with me as well as my associates. And she kind of clarified things, particularly with non-pigmented breeds and what's normal, abnormal. So I found that helpful.
As a new graduate, I didn't get a whole lot of ophthalmology in school, and so just doing the basic general exam and tips and all sorts of stuff like that. We get a lot of working dogs with a lot of ocular abnormalities, especially when they come back from the desert, and so it's just kind of an overview of the ocular exam.
I thought Dr. Bentley gave a very good review of how to do an ophtho exam, and she also gave us some common missed diagnoses, and it was just overall a very good lecture.
As a small animal practitioner who is always trying to learn more about eye problems, here are the 5 points that I found most helpful. The signalment of your patient is sometimes your best diagnostic aid. You miss more by not looking than not knowing. Lots of practice with any ocular instrument counts more than infrequent use of an expensive toy. Turn off the lights for any thorough ocular exam. Any eye with rapidly worsening disease or acute vision loss needs immediate evaluation and possible referral. Dr. Humphreys, ophthalmology is an area where some practitioners lack confidence. This lecture will certainly help practitioners make the decision on which cases to refer and which cases they can successfully treat themselves. So for Conference TV Journal, I'm VNN reporter